Good? Yep. All right. Well, good morning, you guys. Welcome to the forum at All Souls Unitarian Universalist Church. My name is Angela Allard. This is the 80th year for the forum. The forum's been operating since 1943 to provide a platform for the discussion of significant issues in the contemporary world. Our speaker this morning will present for about 35 minutes, and then we'll pause to take a collection and then begin the Q&A period for about 25 minutes. This program is live streamed on YouTube, where viewers can post their questions in the chat, and we'll monitor those questions and ask them of the speaker on your behalf out there in internet land. And for those of you in the audience, please make sure your cell phones are on silent. And we may have some people coming in late. So if you can maybe shift over so that folks coming in the door won't have to climb over you, that would be great. Today's presentation is about the efforts to expand Medicaid in Kansas. Some of you guys might have helped us collect signatures in Missouri to get Medicaid expansion on the ballot a few years ago. We had a great effort from All Souls folks, and it passed. And you're lucky if you live in Missouri, because Kansas is still trying to get it expanded, and they do not have the ballot process or the petition process. So, our speaker today is April Holman. She's the director of the Alliance for a Healthy Kansas, a coalition of about 135 different organizations that are working to expand Medicaid in Kansas. And we welcome you and look forward to everything you have to say. All right. Mm.
Thank you so much. I really appreciate the opportunity to be here, and I love the chance to be able to share more about the opportunity for Medicaid expansion in Kansas and why it's so urgent and why it hasn't happened yet. So, I am April Holman. You are welcome. I think, can we take questions at any point, or are we going to wait till the end?
We need to
Wait till the end. Okay. So I'm very happy to answer questions. I'm going to try and give you as much of a background of information about what Medicaid expansion can do and why it doesn't necessarily always make sense, where some of the current eligibility guidelines lie. So the Alliance for a Healthy Kansas was formed in 2016. And really, it was all about getting Medicaid expansion passed in Kansas. We have since become our own standalone 501c3, and we're working on increasing access to affordable health care. We would dearly love to move on to other issues because we know there are a lot of issues in this field, but Medicaid expansion continues to be a source of contention at the Kansas State House. And so we continue to work on this until we can get people that access to coverage that they so desperately need in our state. We do have about 135 different organizations in the coalition that has formed to get expansion done. It's interesting because you would probably not see those 135 organizations agree on any other issue except for expansion. We have very diverse partners from um, the business community, definitely from the provider community, both hospitals and physicians and clinics. We also have social service agencies who are working directly with people who are in the coverage gap, who are part of that coalition, and a number of faith-based organizations as well. We also have a network of thousands of individuals across the state of Kansas who care about this deeply and who are working in their communities and at the legislature to share why, in their opinion, this needs to be done for the benefit of their community. So, I want to give you some background about Medicaid expansion. It sounds like many of you have participated in the efforts in Missouri, and it's a little bit different in Kansas. So, we just to give you the background about the policy, It came about as part of the Affordable Care Act. The Affordable Care Act, as you know, is even still referred to as Obamacare in some circles. And a lot of the antagonism originally in Kansas, I think, had to do with opposition to former President Obama and really this idea that um, the government should be small and we don't want to see it move into new areas like helping to provide access to healthcare. Um, the um, the way that expansion works is that the federal government pays for 90% of the cost of covering people in the expansion population, and states are required to pay a 10% match. When you look at other programs that the federal government provides, this is pretty much an anomaly. Usually, you don't see this kind of match rate, and it really goes back to the idea that there is a huge need and it benefits all of us across the country when people have the coverage that they need to be able to access affordable health care. It's expected that 150,000 Kansans would benefit from expansion. That's the official estimate. And then the Kansas Health Institute did their own private estimate this year that said it would be 152,000. So pretty close, but they even had it just a little bit higher. So this is definitely something that we need from a number of different perspectives. When we talk about expansion, the main reason that this is important is because we have a coverage gap in our state because we have not opted in to the Medicaid expansion portion. So, just to give you a little bit of an idea, when this was first passed in 2010, the Affordable Care Act, that is, there was this idea that there would be coverage for people all the way from the very lowest income up to 400% of the federal poverty level. So if you look at the umbrella behind me, that image is really showing what the total coverage would be. But you'll notice that we have a blank part in the middle of our umbrella. That's because, as you remember, there were a lot of legal challenges to the Affordable Care Act in those early days. One of the ones that stuck was challenging the idea that the federal government could force states to participate in Medicaid expansion. Because that's a state and federal program, the Supreme Court said that each state would need to opt in. So that's where we get this very strange situation where states like Kansas, who are holding out on expansion, have a huge coverage gap in the middle. So, to tell you a little bit more about that, on the left side of our umbrella, that portion is in red, represents the individuals who are in the current Medicaid program today. In Kansas, it's fairly scaled back. In order to, well, first of all, the general rule for adults aged 19 through 64, which is the expansion population, the general rule is that they do not qualify for Medicaid. They have to meet an exception in order to qualify. So the one of the more utilized exceptions is for people who have a disability that's recognized by the Social Security Administration. That's a pretty high bar for people to reach. For some people, it takes 2 to 3 years and multiple attempts to be able to get that determination. Some people choose not to get the determination at all because it limits the amount that they can work. And so they prefer not to do that. And for other people, they might be ill, but they don't have a permanent disability. So they don't qualify for that federal determination. So we have that exception. We have another exception for individuals who are parents with a child under the age of 19 in their household. Those individuals cannot earn more than 38% of the federal poverty level. So if you think of being fully in poverty, and now we scale that back by 2/3, in Kansas, It's based on household income. So a household of three, a parent and two children, they can't earn more than $9,812 per year before they're already earning too much for those parents to qualify for Medicaid. So I just want that to sink in. Some of us have the idea that if someone is low income and in need of care, that's going to be available to them in the Medicaid program. That is not the case in Kansas, unfortunately. There are some other exceptions for pregnant women. If they earn no more than 172% of the federal poverty level, they can qualify for Medicaid. Um, I really think those are the three main exceptions that exist in our state. On the other side, the blue side of the umbrella, that represents the marketplace subsidies that people can receive to offset the cost of private care. So you might have heard of healthcare.gov or the federal marketplace. It's an opportunity for people to go onto the marketplace website, put in their household size and their income and answer questions, and then they receive an estimate for how much private insurance would cost them with a federal subsidy. Um, excuse me. So you have to earn at least 100% of the federal poverty level in order to qualify for those. And that seems strange that we have a situation where people can earn too much money to qualify for the current Medicaid program, but they actually don't earn enough money to qualify for assistance in the federal marketplace. But you know that that's because of the way the Supreme Court took out the middle portion. And so for states like Kansas that have not opted into expansion, we have this coverage gap. And that's really the basis for our advocacy on this. We want to see those hardworking people who are in the coverage gap get access to assistance for their health care, and that in turn will help the providers, hospitals, and physicians who might be providing care right now for those people, but are not getting compensated for it. So I've been talking about this opting in. 40 states have already opted in. If you look at this map, you'll notice that all of the surrounding states of Kansas have already opted in. I clearly know that Missouri did, Nebraska did, Oklahoma, and Colorado. That puts us at a disadvantage, particularly in populated areas like the Kansas City metro and some other like Pittsburgh and Fort Scott along the Missouri border, and then quite a few communities across the Oklahoma border as well, where hospitals and providers on the other side of the border do not have the same level of uncompensated care that we do in Kansas. So they can lure away our qualified medical providers with higher salaries and signing bonuses. And that's exactly what's happening. So we have everyone across the country has a medical workforce shortage, but in Kansas, it's worse because we're having people who are already in Kansas being poached across state lines. So I want to just hit the highlights. Let me just see something. Yes. Hit the highlights of why it's so urgent this year that we expand and why really we wish that we would have done this 5 years ago. It would have helped a lot of people and it would have helped the economic situation in cities across Kansas. So the first is that expansion would fix eligibility requirement or the eligibility requirements that are way too low now. That 38% of the federal poverty level has been in place for parents for decades. And it really does not reflect a realistic picture of what parents can earn and still be able to support their children today. So we have to remember that there are lots of other things that families need to pay for besides insurance for the adults. It reduces healthcare costs for everyone. So, unfortunately, just because you don't have insurance does not mean you don't become ill. And when people who are in the coverage gap who don't have any kind of insurance go to the hospital and are not able to pay that bill, what happens is that hospital has a debt that they need to be able to recoup. So they raise their prices to the extent that they can to recover that. And that means everyone who goes to the hospital is ending up paying more. They also can't recoup all of it. And so the hospital ends up losing as well. It would protect Kansans from medical debt. This one is pretty clear cut. If you don't incur that Medicaid or that medical debt in the first place because you have coverage, then you are going to be in a much better position as a low income family or individual to pay for other necessities like housing and nutrition and transportation and all of the things that go into living in our communities in 2024. It would preserve and strengthen rural healthcare. We have a real problem in Kansas with rural healthcare. Medicaid expansion is not the only thing that needs to happen in order to preserve that. But as we are making innovations in our delivery system for rural healthcare, we always are going to need to have a payer source. So those people who are in the coverage gap are always going to need to be able to pay for their services, whether it's in telemedicine, whether it's in actual services at the local hospital or clinic. And so Medicaid expansion would go a long way to helping with that issue and with the issue of rural hospitals and providers being financially unstable. We've seen 8 hospitals in our state close since 2015. So that would be a year after 2014 was the first year that states could opt in to expansion. So we're seeing hospitals close. We're seeing an awful lot of hospitals reduce the amount of services that they provide because they don't have the finances to bring in specialty providers. And so they can't provide cardiac services or other specialty services that they might have before, and it's creating huge problems out in rural areas because if the hospital goes under, in many cases, that's the beginning of the end for that community as well. And then it also helps a general workforce shortage in Kansas. So basically, we have a lot of need for people in the workforce, and we have a lot of Kansans who are not well enough to work, whether they face physical or behavioral health challenges. If they had access to health care, it would help them to be more likely to join the workforce and remain in the workforce. And that has actually played out in states that have already expanded. So, for instance, in Ohio, they were one of the early adopters of expansion, and they've done some pretty extensive studies about what the impact is on being able to work, and it's definitely positive. Okay, so there are opposition arguments to expansion, and we always like to prepare advocates to understand what these are so that they feel confident in pushing back. One of the things that we often hear is that somehow Medicaid expansion would harm people who have a disability by putting them at the end of the line for services. So I just want to assure you that that is not the case. The funding stream for the expansion population is entirely different from other funding streams within the Medicaid program. So really, it's kind of almost like a comparison of, do we invest in roads? If we invest in roads, are we putting people with disabilities at the end of the line? And or whatever, jails or whatever the state might choose to invest in. Often we hear this in the context of home and community based services to help people who have a disability to receive services so that they can stay in their homes. We have waiting lists in a couple of those programs, and we absolutely at the Alliance think that there should be more money that's put into that. The part of the Medicaid program that we're talking about, though, is what actually gives people access to healthcare, and that already occurs for people with disabilities. So they're already getting this part of the assistance. And quite honestly, every organization that supports and represents people with disabilities in Kansas supports expansion for a couple of reasons. The main one is that many people who have a disability in our state don't qualify or haven't sought that Social Security determination that we talked about earlier. So they would directly benefit from having coverage under expansion. We see that particularly in the area of degenerative diseases. So when we look at like MS or diabetes, that if you don't have access to care early on, that progress of those diseases are going to happen. You may eventually end up with a disability, but we would much rather see those people get care before they have a disability. So that's one of the reasons. And then the other main reason is because the care providers who help people with disabilities are, by the nature of the way that they are paid, they end up, many of them, being in the coverage gap themselves. So when they have access to affordable health care, they're healthier, more able to be on the job, and more able to be a really active part of that person with a disability's life. The next one, and we hear this all the time, and I don't really understand why, it's not true, is that expansion would really only help single individuals who are not working. So um, we know that it helps many parents, and it helps many people who are living within family units. And actually, part of the problem is that it's more difficult to reach that 100% of the federal poverty level to get subsidies on the marketplace if you have more people in your family. So people with larger families are actually penalized in this program. Again, it's counterintuitive. That's not the way things are usually done intentionally. But because of the way this came about, that is in reality what happens in Kansas. Um, Also, 69.1% of the people, wait, is that right? No, 68.1. So we round it to 69% of the people who are in the expansion population are working themselves. And the remaining 31%, many of them are either have some sort of disability or illness. About 19% have that. That makes it hard for them to work. Either work enough hours in order to meet that 100% of the federal poverty level, or they can't work at all. There are also a number of people within that non-working portion who are caregivers to a family member, either under the age of 5, maybe someone in their family with a disability, or a senior that needs help. Many of them are students. Um, some of them, about 3%, are veterans who are unable to, especially when we get outside of the major urban areas like the Kansas City Metro, Wichita. We have Veteran Administration hospitals, but when you get out into other places in Kansas, it can be a very long drive for people to go and get their care from those facilities, and they don't have coverage that will help them get care in their own communities. So, and then we keep hearing that expansion is going to bankrupt Kansas. It's bankrupted other states. Other states are trying to reverse course and get away from expansion. The truth of the matter is that this opportunity has been around for about 10 years. No state has reversed course, even though it's absolutely permitted under the federal law. And when we hear people say, you can't turn back after this, that is only because states the people, the citizens, don't want that to happen. It's more of a political statement, and the reason is because it's making a huge difference in the lives of constituents, and that's why it's not going to go back. Which to me actually says the opposite of what they are trying to say when they say you can't turn around. 40 states have already done expansion. So if we were to see, like sometimes people will say in the opposition that there would be a reduction in how much the federal government would pay. So instead of that 90-10 match, they say it's going to go down. That would require an act of Congress because the match rate is in statute. And so you would have to envision at least 80 senators who would vote against the best interests of their state in order to do that, which seems like not very likely. We also have seen in all of the main expansion bills, there's been a poison pill that has said if the match goes below 90, the program automatically goes away, and legislators would need to then vote on whether they wanted to continue it or not. So we don't feel like that's a risk because we don't think that there would be a reduction. Okay. So, as far as the status of where we are today, we were really excited because as a result of really grassroots advocacy this year, we had a hearing in both the House and the Senate. So, on the House side, the bill number was House Bill 2556, and in the Senate, it was Senate Bill 355. They did not have a specific bill hearing in the Senate. They had an educational hearing that happened on March 20th. And on the same day, they had a bill hearing in the House. On the House side, they voted the following day and did not vote. Bless you. They did not vote to move the bill out of committee. And there has been some maneuvering on the House side that has made it so we cannot do the same thing that was done in the Senate on that side, which means that we are, for all intents and purposes, kind of out of luck on the House side this year. On the Senate side, there was a motion that was made right before the end of the regular session to pull the bill, Senate Bill 355, out of committee. The way that works is the vote for that will happen on the first full day that they come back at the end of this month. That first full day is the 25th. They're going to be pro forma. They're just going to be doing some conference committees and what have you that day. So the actual vote will be April the 26th. And we are really reaching out to as many of our grassroots people as possible to have them contact their senators and let them know how important expansion is to you, and then also what a difference you think it would make for the community. And urging them to pull the bill out of committee, even if they don't support it, just so that there can be that open conversation on the floor of the Senate. I just want to kind of let you know that as an organization, we have really focused our advocacy work on reaching out to communities and helping people across the state of Kansas understand more about what expansion is and why we need it, and dispelling some of the myths that are out there about expansion. As we think that with the political conversations that are happening at the state house, the only way that we're going to be able to get past that is by really having a lot of citizen activity in this area. So we are doing things to build the movement through community meetings, digital advocacy. We are encouraging people to write op-eds and letters to the editor to make sure that people in your networks understand about expansion. And then we do have these action alerts. We have one right now, and I actually have some handouts that have QR codes. So if you're comfortable with QR codes, you can scan them and be able to go directly to the place where you can sign a letter to your or an email to your senator and what have you. Another thing that the Alliance does is collect stories of people with lived experience in the coverage gap. And so, just to give you an example, we have spoken with a variety, I mean, it's actually heartbreaking, a variety of individuals who desperately need access to affordable health care and don't have it. We've had at least one person in our story bank die during the time that we have been doing this because he didn't have access to the healthcare that he needed. We have met several people who are survivors of parents and family members who have passed away because they didn't have access. Some of the things that we know about that are like, for instance, with cancer, your survival rate is cut dramatically if you don't have insurance on the day that you were diagnosed. For some, that makes a lot of sense when you think about it because people are less likely to get something checked out if they don't have insurance and they know they're going to incur a big bill. So if you feel a lump or if you feel a little bit off, you might not be going to the doctor until later when the condition is more acute. And in fact, that's what happens in the case of cancer and some other really um, tragic diseases. So, if anyone knows someone, or if you are a person who is in the coverage gap, or maybe you volunteer with individuals who are in the coverage gap, and you would be willing to share their story, we can do it in an anonymous way. We can do it in a third person sense, but we want to be able to dispel that myth that this is someone sitting on they're like a 30-year-old man sitting on his parents' couch and choosing not to work. That's absolutely not the case. And we need to be able to demonstrate that more to policymakers and also to the public. Um, so this is how you can contact us. We have 4 people on our team right now, and then we work with some contractors as well. All of our email addresses are our first name followed by expandcancare.com. So I'm April at expandcancare.com. Our story bank specialist who works with people who have stories to share is Chandra at expandcancare.com. And then you'll also see Lacey Kennett is our communications director. She can help if you'd like to write a letter to the editor or an op-ed and you're not sure where to start. You can reach out to Lacey and she'll help you. And Marissa Alcantar is our policy and advocacy specialist. So she has a lot of answers to questions about the policy for expansion. With that, I'd love to stand for questions that you might have if there's anything that was not clear about the policy, or if you have concerns or things that you want to bring up. Oh, sorry. Sorry, I forgot that. Yep.
Yes. Ah, all right. Well, thank you, April. I learned a bit, and I've been trying to be as involved as possible with Medicaid in Kansas, even though I'm a Missouri resident. And so thank you. That was some very helpful information. So we're going to take up a collection to help offset the costs of the forum, and we appreciate your contributions both in person and online. And as a reminder, this program will be rebroadcast on KKFI 9 days later, so on Tuesdays uh, at 7 p.m. So very quickly, next week our program is Prosperity. I'm not sure it's unleashing human potential, and we were asking this morning if they're actually going to bring some animals in to the forum next week. So it could be very interesting. Come on down next Sunday. Okay, so now we're going to do Q&A, and if you'd like to come up to the microphone, form a line, we've got some anxious people ready to shoot you some some questions. Yes.
Very much. Thank you very much. I'm from Kansas, so why I'm here actually. Um, they just passed a big tax reduction in the state because they had a huge surplus. So I'm interested in if there's 130, 150,000 people expected to benefit from this. How much money are we talking about every year? Is there a figure there?
There is. So it's estimated that the 10% Kansas cost would be somewhere between $60 and $70,000 a year. Is that right?
70,000 or million?
Or sorry, about $70 million a year. One of the things that I didn't tell you, which I should have, is that the federal government provides an incentive for new states to expand. So that's expected to be about $509 million that would come to Kansas. It's one-time money, and it would come in over the course of 2 years. So that would be more than enough to pay for the first 2 years of the state portion. Actually, it could pay up to the first 8 years if the state set that money aside.
Okay, well, I'm glad you have brought that up because it sounded to me that Kansas would make money by
We
expanding.
will make money. That's right.
Okay, so then the next question is, what is the real reason that the Kansas legislature, which incidentally is capable of any kind of illogical thinking, what is the real reason that's preventing this from happening?
I think that there's some level of antagonism between the Republican led legislature and the Democrat governor. And so sometimes we hear that they are not interested in giving Governor Kelly a win on this issue that is one of her top issues every year. I also think that part of it boils down to the idea of a philosophy that government should be small, and this would be an increase in the scope of government. I think that, a lot of the opposition talking points are things that don't make sense to us necessarily, because when you look at the data, it does not seem to reflect the realities in other states who have already expanded. But I think that it does boil down to this idea that government should be small.
So this is really all about politics and ideology.
It is about politics. So of the 40 states that have already expanded, there are many, many Republican states that are in that group. Indiana passed Medicaid expansion when Mike Pence was the governor. So I think that, you'll see that this is not political everywhere. It is has just become very political in Kansas and some of the states in the deep south. But even with those states, we're seeing some serious progress this year on expansion in Mississippi, which is a strange state for us to fall behind.
How did you ever get 135 groups,
Oh,
separate
yeah.
groups, to agree on anything?
I think it's really interesting. There have been attempts in past years to combine expansion with other things. So one year they combined it with the legalization of medical cannabis. We could not get the members of our coalition to agree on that. We had to stand down on that particular bill because, yeah, we didn't come close to consensus. So I think you're right. It's very difficult to get that many groups to agree. And I think it's a testament to why this is important and how important it is from a lot of different aspects.
Is there any evidence that people that can't get Medicaid in Kansas City are moving to other states to get it?
We know that it's happening, and we're starting to see more data that will reflect that. I don't know that we have a really strong case yet when it comes to the data, just because in Missouri, you all have dragged your heels a little bit in terms of implementing expansion. So we're not starting to see the full effect quite yet. In states like Oklahoma and Missouri passed expansion at the very same time, and Oklahoma just implemented it, and it's made a huge difference there. So, mhm.
We'd like to encourage our YouTube visitors to ask questions, which we don't have any at this point. My son is a recipient of Medicaid issues in Missouri, where it affects his pharmacy
Mhm.
supplies,
Mhm.
expensive neurological drugs that he has to take. Um, and we're thinking about moving. Would you consider moving to Kansas or not?
Oh, wow. That is a really good question, because as a Kansan, I want to promote our state every way that I can. But sometimes, just quietly, as we're talking with people through our Story Bank program, we will sometimes say this might be, if you're able to move to Missouri or, one of our bordering states, that might be something for you to consider so you can get access. I think it's a really important thing for people to look at before they move.
I had heard a few of local sheriffs that deal with prisoners
Mhm.
talk about the need for Medicaid expansion. Could you explain why?
Yeah, there's a couple of different reasons why there's an impact in the justice system if we have expansion. The first of them is that you will see fewer people coming into contact with police and sheriffs and the justice system overall, because they would be able to have their behavioral and physical needs met. And so we see a lot, particularly in rural areas, but I think it happens in cities as well, that there's nowhere else for individuals who are having a mental health crisis to go except the jail in some cases. And so it becomes a huge expense to the county. And it's also not the best placement for the individual either. It's really a lose lose. And so being able to have access to affordable healthcare, mental health care, is a big deal in that. Once people enter into the jail, they're the responsibility of the county. And so, in some counties, in Sedgwick County, for instance, they were describing like almost expected overruns of their budget every year, because there were always going to be maybe one or two of their jail inmates that might have a serious health problem that requires expensive medications or other things. So, by having expansion, it would help with some of those costs. It would certainly help people as they leave the jail to very quickly get access to the care that they need, so that they'll be less likely to end up back in the jail through additional whatever got them there in the first place, or other additional crimes or situations. So I think that it does make a big difference. We've heard that throughout the state there are big issues with those costs at the county level.
Coupled with this issue of economics with Medicaid and Social Security, um, a number of people who are handicapped or marginally handicapped have this limit of how much they can earn, or they'll lose their Social Security or Medicaid. Do you see any advancement in even Missouri or in Kansas to essentially try to reduce that consequence?
I think the thing about Medicaid expansion that's a little bit different from other programs is that it is income based, as opposed to having an asset um, uh, test as well. So this is really just based on the income of the individual, and you don't see people having to spend down their safety net of savings in order to participate. So I think this is something that would not impact some of those Social Security income situations, but it would help people to get access to healthcare. I think that's something that we really need to reiterate. This is not a payment that individuals receive. Often the opponents will say, once people get their Medicaid coverage, then they're not going to work, which doesn't make any sense because you can't survive on just having access to affordable health care. You're still going to need to earn resources to be able to pay for your housing and nutrition and transportation and all of the things that go into living in our communities. So I think that that's just another thing that I'd like to reiterate. This is basically insurance. It works slightly differently than insurance, but that's the impact of expansion.
We my little group of bicyclists have been meeting with representatives to talk about KanCare expansion. And some of the things we hear as is abortions might be covered, and the feds may not follow through. They may not continue giving us the 90%, and things like that.
Yeah.
Um,
I think those are, in my opinion, those things are smokescreens. So a few years ago, back in 2020, there was an attempt. We really thought that there had been a compromise that was reached in expansion that would result in passage of the bill. So then Senate Majority Leader Jim Denning, who is from Overland Park, I believe, Johnson County for sure, had worked with the governor to come up with a compromise that everyone felt comfortable with. At the same time, there was a lot of work that was happening on the value them both effort in Kansas. And in order for an issue to get on the ballot in our state, you have to have a supermajority voting in the House and Senate. And then it goes to a vote of the people. So that first year that they tried to do it, it was very contentious, and there was an intentional effort made to tie Medicaid expansion to that issue so that they could garner additional votes from Medicaid expansion supporters to vote for value them both. So we saw at that time where the Catholic Conference had been supportive of expansion in the past, they withdrew their support until Value Them Both passed. And they certainly talked about concerns of people being more able to get reproductive services if we were to have expansion. The way that thinking went is like this. So, even though, because we talked about one of the exceptions being women who earn up to 172% of the federal poverty line, that means that all of the individuals who would gain access to Medicaid through expansion already qualify if they're pregnant. So there would be no change there. But they were saying that if you had access before you got pregnant, then you would be able to most likely find out that you were pregnant sooner and then be more possibly able to have an abortion. Because sometimes you wouldn't find out until later under the current program. There are so many concerns with that way of thinking. It really ignores the idea that babies are healthier if their moms have access to prenatal care and if they're healthy before they become pregnant. And it also ignores all of the things that go into those first few months of pregnancy that are so important for the baby and the mom. Once that passed the legislature, the Kansas Catholic Conference very quietly walked back their opposition to expansion. They have policies on their books that they don't talk about that much that say that they support expansion, but nobody really, a lot of people are have a misguided idea that it's still something that would impact the number of abortions that might occur in Kansas. Um, it really, they're not related things, but some of the people who oppose expansion also oppose women's right to reproductive services. So it's convenient to bundle them all up together. And then you had mentioned something else, that it's the money that. Right. So we continue to hear this idea that the federal government might scale back how much they pay or stop altogether paying the 90% match, and then states will be left having to either disappoint their citizens or having to come up with the difference. Again, that goes back to the idea that this is set in statute. So, in order for that match rate to change, there would need to be an act of Congress. It would need to include the representatives and senators from those states that have already expanded, 40 of them. So, in the Senate, where there are 100 senators, that would mean 80 senators would have to be willing to vote against the best interests of their constituents, which seems highly unlikely at this point.
You mentioned the issue of a supermajority in Kansas, and with the governor having veto after veto being overridden by that supermajority. Do you see any vulnerability in that supermajority in the near future?
So one of the things, I think that there are a lot of efforts to break that supermajority. The Alliance for a Healthy Kansas is organized as a nonprofit charity, and one of the things that means is that we can't become involved in election issues. So we don't work on that, but I think that there is effort that is going into that. Because of not just expansion, but many other issues. And I think that, it's hard to overlook the influence of that supermajority, but I'm confident that there are organizations and others who might be the best people to talk to about that for sure.
I believe that Governor Kelly in the proposed bill added in some work requirements that may not be acceptable to the federal government, but they're doing that to try to get this passed. Can you describe what those work requirements are?
Sure. So I will start by saying the Alliance for a Healthy Kansas and our coalition do not support work requirements. And the reason for that is not that we don't want people to be working if they can, but that work requirements tend to be just another hoop or more red tape for people to get through. And we know that almost 70% of the people who are in this population are already working. So it doesn't seem like that's a really needed component. And in other states, it's certainly been used more to bring down the number of people who are receiving services as opposed to encouraging work. That's been the ultimate effect. I think that the proposal that Governor Kelly did this year is based on a work requirement that already exists for people who receive SNAP, something that used to be called the food stamp program. And so they are using a model that has already been accepted by the federal government, although it's a different agency than the one that would need to approve the work requirements for Medicaid. Uh, I think that, it does provide some flexibilities for people who might already be ill, which I think is really good. If you have to have a work requirement, that's very important. In Arkansas, they had work requirements that went into effect. Really, it's the only state that has had a work requirement and was allowed to keep it for long enough to see what the results were. I think they had it up for 5 or 6 months. And 18,000 people lost their coverage during that time. And they also saw that there weren't exceptions for things like people who have active illness. So there were cancer patients that were having trouble midway through the course of their treatment, being able to keep their coverage. And I think that the Kansas version that the governor has proposed does provide some of that flexibility. So a little bit less onerous than some of the ones that we have seen. But certainly, there's precedent for that to pass muster with the federal government. And I don't agree that it's something that would, that, for sure we know that they won't accept. So I think, work requirements, I'm not a fan. But I also don't necessarily agree with the opponents that this would not be accepted.
I was able to attend those hearings that
Mhm.
that happened in the House and the Senate, and there was testimony from a hospital administrator from Hutchinson, Kansas, and I was just wondering if you could kind of uh, I'm sure you heard this
Yes, yeah.
also about his experience of Medicaid expansion here, not happening here and happening in Colorado, and what happened there in Reno County.
Yes. So the individual's name is Benjamin Anderson, and he did a really great job of showing what's possible in an expansion state versus a non expansion state like Kansas. So he is currently at the Hutchinson Medical Center, but he had worked in a smaller rural healthcare system in Kansas, and then he moved to Colorado where they have expansion. And worked there for some time and then has come back to Kansas. And he said that, like, they were actively recruiting physicians and other medical personnel from Kansas, knowing that they would be able to pay more. So kind of it's kind of underscoring that idea that we are losing our providers across the border. He talked about actively being one of the people who were trying to do that because there are shortages of healthcare professionals all across the country. And in places like Kansas and states in the deep South, there are individuals who might be willing to drive or commute or relocate in order to be able to get those higher salaries. I think he talked about, you know, the decisions that need to be made as well in terms of how do we care for this patient that is in our care? Do we need to figure out the least expensive way so that we are not bankrupting our hospital? Do we need to, base our decisions on what medications they might be able to access? Or can we, in the case of Colorado, can we just move forward with the best um, care that is possible? And when I talk about some of that, I want to clarify that it's not necessarily the hospital that's making those decisions. It's the patient who's saying, I can't pay for that, so I don't want this medication, or I don't want to take this course of recovery because I won't be able to pay for it. And many Kansans, particularly in rural areas, there are a lot of people who will not get care that they know that they can't afford to pay for. And it's really detrimental. I know that we're in an urban area right now, but many of us have ties to rural areas or might have family in those rural areas. And It is really important that there is a hospital nearby. We have some people who are traveling like 100 miles one way to get to the nearest hospital. That's particularly an issue with maternity care. But you can also think of, if you were having an emergency and you needed to get to a hospital quickly, they have some ambulance services that will help with that. But it really is a big problem if you have a long distance to go in an emergency circumstance. And even if you are able to get there with an air ambulance more quickly, the cost of that can sometimes be absolutely life changing in terms of that individual or family's ability to afford everything else and pay for that. So,
Thank you. Thank you so much for all the information and for everything that you guys are doing. So,
well, thank you. This was a wonderful opportunity. I
yeah.
appreciate it.
All right. And next week we have prosperity.